Okay. So, hello and welcome to this session of Spotlight on Chatham, brought to you by the Chatham County Democratic Party. These 40-minute sessions are intended to be nonpartisan conversations about Chatham County government programs and public services. My name is Vicki Shea. This session is being recorded on July 2nd, 2026, and our guest today is Mike Zelek, Public Health Director of the Chatham County Public Health Department. So thank you, Mike, for spending time with us today.
Yeah, thank you so much for the invitation.
So I understand that the health department provides a range of services. So let's start with what many people think of first when they hear health department, which is a clinic to receive health care. Where is the Chatham County Health Department clinic?
Well, first of all, thanks again for having me, Vicki. I really appreciate the opportunity to talk about what we do in public health here in Chatham County. We have two sites. Our clinic is located in Siler City near Jordan Matthews High School on South 10th Avenue. We also have a facility separate from clinic in Pittsburgh on East Street.
Okay, so the clinical services are delivered in Siler City at the clinic there.
That's
Okay.
correct.
And what healthcare professionals work there for the health department?
Yeah, we have a range out of our clinic. So we have many nurses, we have medical providers, practitioners, we have social workers, we have interpreters, community health workers, registered dietitians, um, admin staff, billing staff, of course. It's a range of folks who are critical to the services we provide out of our clinic.
Okay, so of the physicians and the nurses, are they full-time located there, or are these contracted people who are there certain days, certain times, certain months?
Right, it's a mix. So our nurses are predominantly located there as full-time staff, and then our providers, our medical director, and our providers are contracted.
Okay, and when you say providers, I, I know what that means, but
Yes,
explain
like
it
nurse
more.
practitioners.
Okay.
Correct.
Nurse practitioners, okay, and MDs.
So our medical director is an MD, and then we have the nurse practitioners who do much of the seeing clients.
Okay, all right, great. And so what medical services in that broad sense of from all these practitioners, what does the health department provide and what do you not provide?
Yeah, it's a great question, and I'm always hesitant to answer these questions because I'm always going to leave something out because there's so much that our wonderful team does, but I'll do my best to capture it all. So while we don't do primary care because we're located right next door to Piedmont Health Services, which is a federally qualified health center, and they provide a range of primary care services. We do a lot of clinical services and what we call wraparound services. So anyone in Chatham County can get immunizations through us. So get your shots, like your flu shot, COVID shot, or your, like kids' recommended vaccines. We have services for family planning, sexually transmitted infection testing and treatment, communicable disease, nutrition counseling. We have some behavioral health services as well as substance use services like medication for opioid use disorder, which is something we added in the last year. We offer PrEP, which is pre-exposure prophylaxis to prevent HIV infection, hepatitis C treatment. We have it's called the BSEP program, that's Breast and Cervical Cancer Control Program, that supports women in our community with things like mammograms. Um, I think I've covered most, but let me check my list because I always leave something out. But that's the gist. There's many more, and you can always go to our website and see all the services that we offer if you're interested in more information about what we do.
Okay, I want to ask you about a few of those, but the website would be what? How would people find that?
Yeah, just go to the county website, chathamcountync.gov, and you'll search public health. And on our website, you can see pages related to the specific programs, whether those are clinical services, environmental health, health promotion, what have you, Board of Health. We have everything listed there.
Okay, so of the specific, some of the specific health services that are available there, you listed um, immunization, right? So flu
Right.
shots and it, COVID shots and
Childhood vaccines, all of that, and we have some programs that are funded through the federal government to help cover costs if make those vaccines more affordable, especially with children. We've taken on some things in Chatham County so we can offer flu shots at no charge to Chatham residents. So there are things that we try to do working internally as a department or in the county, and then working with our federal or state partners to make services more affordable and accessible.
okay. And you also mentioned a program for opioid dependence treatment, or I don't know the exact words for that, but tell me a little bit about that.
Yeah, so we do a lot of work around overdose prevention, and we each municipality receives what are called the opioid settlement dollars, and the health department's really tasked with overseeing and coordinating those efforts in partnership with many others. But out of our clinic, we have what's called medication for opioid use disorder, or MOUD. I may hear it called MAT. And that's basically for somebody who is struggling with addiction. These are medications that can help them overcome that addiction. So we started offering that, trying to create more access points in Chatham County. We started offering those services about 6 months ago. And we've seen some uptick in recent months. Some folks who are, were traveling elsewhere, were struggling to get in somewhere to get those services. We're able to support them, and we've been able to leverage some grant dollars to make those no cost for Chatham residents. So if somebody has insurance, we'll certainly accept it. But we, like I said, leverage grant dollars for those who are uninsured or underinsured to make sure that they can get this important service. And then we can complement it with some behavioral health services as well, in addition to all the other services that we provide out of our clinic.
Okay, I was going to ask that. So if somebody has a substance abuse disorder and is having sort of uncomfortable symptoms or cravings or something like that, are you saying that there's medication to help address that along with some psychological or behavioral health support?
Correct. That's exactly correct. This is an evidence-based treatment option, and there are several providers of it in Chatham County, and we are now one of them. So certainly, folks can come to us. They can go to Piedmont or Chatham Recovery or Daymark. There are a number of providers. I think UNC also has some services. So whatever fits them best. But we wanted to make sure those services, complementing the other work we do around overdose prevention, were accessible through us as well.
Okay. And and so if people need something like that, they can start at the health department and then get sort of directed towards the provider or the service that would be most appropriate for their situation.
That's absolutely right. And that's a lot of what we do in public health is connect people to resources. And sometimes we connect them to us and we provide that service. And sometimes we connect them to other providers or we give them a list of options so they can pick what makes most sense for them and their situation. But they're welcome to reach out to our clinic in Siler City to inquire about those services and talk through it. They could also start if they have a primary care provider, they could reach out to them and talk through it. But they're always welcome to reach out to the health department.
And can you slowly say what your telephone number is?
Yeah, so in the clinic in Siler City is 919-742-5641.
Okay. And not to belabor this, but just one other question, because people hear a lot about Narcan and that Narcan is something that people in situations where there might be overdoses should carry Narcan with them. Is that something that people can get from the health department?
Absolutely.
Oh,
We have it at both of our sites. We have a decent supply. I believe in the last year we've given out over 1,000 kits. And so, as you mentioned, if somebody's having an overdose, um, somebody can administer what's called Narcan or naloxone. We have, including the nasal version, which you just kind of inject in somebody's nose. and it's safe, and it will basically reverse the symptoms of an overdose and basically keep them alive. So it's very important. We also look at, overdose and substance use, try to destigmatize it. It affects so many, and what we're trying to do is provide resources to the Chatham community that benefit them, that can help meet them where they're at, and hopefully get to a better place. And so Narcan or naloxone is something that we offer. We do trainings as well on how to use it. We distribute to many partners, but at either of our locations in Pittsburgh or Siler City, you can get it in the lobbies, and also in Siler City, we have a vending machine. It looks like a snack vending machine, but it's no cost. And you can get naloxone from that vending machine to take with you as well. So we encourage folks to carry it, to have it in case they need it. And there's some other great resources in that vending machine as well.
Wow. Okay, that's unique. And so in Pittsburgh, as I understand it, that's not where the direct healthcare providers are. But where is that office and what happens there?
Yeah, so Pittsburgh, our location, which is where I am right now, is at 80 East Street. So we're right off the traffic circle by the old courthouse. Just right next to, there's a gas station right off of there on East Street, and we're right next door. And so in Pittsburgh, we have our administration division, which includes me and like the overarching supports finance, personnel, strategic planning, accreditation, quality improvement. Then we have a health promotion and policy division, which does all the health promotion work. We have programming to support parents and fathers, child care centers, as I mentioned, the opioid overdose prevention programming, among several other things like data and communications, community assessment. And then we also, do some work with schools and youth health. And then we have environmental health as well. So when you think about restaurant inspections, environmental health does it. So they inspect and permit private wells, private septic systems, as well as restaurants, hotels, skilled nursing facilities, childcare centers, schools, tattoos, pools. All of that falls under regulated services from environmental health. So if you see that restaurant score on the wall in the restaurant, that would be a local environmental health specialist from the health department that conducts that inspection and grants that permit. And they also do environmental health, the broader things that impact the well-being of residents. So that could include heat action planning, which is timely right now. We're in early July, and I think it's supposed to hit 100 today. So we've worked with partners to establish cooling centers at the libraries. We've worked with Chatham Transit to offer free rides to those cooling centers. So to your nearest library when they're open, and basically during the week, you can get a ride from Chatham Transit at no cost to you to get you to that cooling center, which is a great opportunity that we continue to try to promote for those who could benefit from it. We have lead poisoning prevention programming out of environmental health. We do a number of other things, whether it would be looking at water quality, like emerging issues like PFAS and things like that. There's a range of work. Environmental health is very broad, and as you can hear, the health department services in general are very broad. So we have about 60 staff, and they do a range of amazing things to keep Chatham County healthy.
Right. So if people think that the health department is just a little clinic where you go in and someone looks at your sore throat, that's probably the least accurate understanding of.
That's kind of what a lot of people see, or where you go to get flu shots. And, and we still do, obviously, much of that direct care. As I mentioned, we're not in primary care anymore, but we still have things like immunizations and related services. We even offer newborn home visits for families to support them, make sure they're in a safe environment. But that's only part of what we do, right? So a lot of what public health is about is coordination and partnerships. So I say public health is a team sport. We can't do this work alone. And if you think back to the pandemic, you probably remember that. So we certainly offered vaccines, COVID vaccines, in early 2021. But we also coordinated with other vaccine providers to get them their first doses of vaccine so we could make it more accessible to the Chatham community. We worked closely with with businesses, workplaces, schools to try to keep COVID from spreading in those settings. We had communication campaigns to get the word out, raise awareness of the ever-changing guidance during COVID, as well as doing community assessments and looking at the data and really understanding how our community was doing then, as we continue to do now, whether it be directly related to COVID or some of the other factors that maybe were impacted by the pandemic as well, economic well-being, job status, stress, all of those things as well. So public health is very broad, and we say it's not just working with individuals. Public health works with populations, works with communities, works with partners. So it takes all of us to, of course, create a healthy community, and that's why, as I said, public health is a team sport.
You also have to keep changing as new diseases and stresses and sort of dangerous situations in the world. You have to come up with ways to try to mitigate that or try to reduce it or treat it or do something with it. So it's not the same every 10 years that you look around and you're doing the same things. Yeah.
Yeah, we try to evolve and adapt, and that's been our kind of mantra. And certainly, whether that be with direct services, looking at, like I mentioned, partnering with our neighboring facilities that have robust primary care services so that we can complement it with wraparound services or other core public health clinical services. Looking at the world is getting warmer, and so we need to do more to keep people safe during these summer months. And that's where the heat action planning comes into play that I mentioned earlier, looking at emerging contaminants, whether it's water quality or whatnot. Chatham County has a lot of ticks. If you've spent time in the woods, you probably noticed that. We have these great tick kits. You can stop by our facility in Pittsburgh and pick them up. They have tweezers and information about tick-borne illness and ticks. It's a great resource for the Chatham community, especially given how many ticks there are. And we often are among the highest rates of tick-borne illness in the state. So we try to do some work both on the education and then, like I mentioned, the tools we can give to the Chatham community to help address these issues. So it's a range of stuff that we offer,
You're
and we
busy and you
welcome
take a
anybody
lot
to
of,
get them.
you must be in a lot of meetings too.
A lot of meetings. That's part of what public health is. So I
Yeah,
don't
if you're
deny that.
connecting to resources and connecting to people who can provide. Yeah. So can you just briefly explain um, Piedmont Health Services and the Public Health Department and what the relationship is and how people know whether to go to one or the other?
Yeah, it's a great question. So we work closely with Piedmont. As I say, our clinic in Siler is located, literally we share a parking lot with them. And then Piedmont has another site in Moncure, as well as the PACE program for older adults in Pittsburgh. And so Piedmont does a lot of direct clinical care for folks with insurance, without insured, uninsured, underinsured. Um, they offer primary care. They have some mobile health services. So there's a lot of what they do that's so critical to the health of our community, which is part of why we partner with them. And then we offer, some supportive services. So it can be, in some cases, it can make sense to, for example, get your immunizations through us. It can be a little bit quicker of a process as you don't have to have a provider visit to get it through us. Things like that, in addition to things like we've supported childbirth classes. So will they do like prenatal care? We'll complement it with some collaborative work, building coalitions to support maternal and child health, offering childbirth classes through a partner of ours. And I mentioned the newborn postpartum home visits as well. So you see where this partnership, we work better when we work together. And so we don't have a gap in prenatal care because they're there. UNC also provides it, among others, but it allows us to focus on some of these other services. And I think public health, in addition to doing the work we do out of our facilities, does a lot of great work out in the community as well.
And I've sort of focused in on the opioid, but I forgot to ask about birth control. Where would a woman who wants some kind of birth control in Chatham? What are some options for where?
They can certainly come to our health department. I'm sure they could go to their primary care provider as well, or Piedmont, but we offer those services as well.
Okay.
We don't offer abortions, but we do offer a range of family planning services.
Family. Okay, great. So you mentioned some of this, but if you could just review, do people who ask for your services, all different kinds, but the clinical, but also probably the preventive and health promotion services, do they have to be Chatham residents? Do they have to be American citizens? And do they have to be low income?
Yeah, so it depends on the program whether residency is required, and that depends on how it's funded. If we get state funds or federal funds, oftentimes residency is not required, and things like communicable disease, where you're really trying to prevent the spread of disease, then residency is not required. And then if we're like for opioid use disorder medication, then Chatham residency would be required because we're covering it with our internal dollars. So things like that can come into play. So it's really kind of program by program. We don't check citizenship status in what we do. So what I was speaking to was more about being a Chatham County resident. That relates to how the program is funded. And then your third question was
The income level.
income, right?
Can rich people come to you?
Yes, absolutely. So we take insurance. We have a sliding fee scale for those who are uninsured or underinsured, and so we try to make these services accessible. And we're talking a lot about the direct clinical services we do, but like naloxone that we mentioned earlier, we encourage folks to have it because if you come across somebody who's experiencing an overdose, we want you to have the tools to help reverse it. You could save a life. And that's across any income level. And so anybody can go to our facilities or go to that vending machine I mentioned and pick up naloxone to have in those situations.
So the facilities and the famous vending machine, is that available sort of during typical work hours? Is the
So the
building only open? Yeah.
Yeah, I got you. So in the facilities, yes, during normal business hours, like the standard, pretty much 8 to 5. But the vending machine is 24/7. That was an exciting thing. So it's climate controlled. So it sits outside of our clinic in Siler City. And we were excited to be able to get a nice vending machine that could withstand the elements so that it could be 24/7 access. So that was something we were excited about. So yeah, you can
So,
go there anytime, but you can, if you want to come to Pittsburgh, that would be during our normal office hours.
okay. And again, specifically, what's the address in Siler City of
1000 South 10th Avenue in Siler.
1000 South
10th.
10th? Okay. All right. Very good. So people can find you on the website or on the phone numbers that you've given. Given this incredible range of things that people do, how many employees does the overall health department employ?
We have around 60 employees.
Okay. And then additional contracted providers?
Additional contracted. So some of our employees are grant funded. Some are contract. I'm very fortunate in Chatham County to have a community that supports us. So we're able to offer such a wide range of services, many of them, of course, being mandated services, but some additional ones as well. But yeah, about 60 overall.
And are those 60 Chatham County employees?
So yeah, most just about all those would be Chatham County employees, and on top of that, we would have a couple of contracted staff, and yeah, I would say over 90% of those are Chatham County employees.
Okay. And so given that it sounds as though you have state money and county money and federal money, is that
That's
right?
right, and grant
Okay.
money.
And grant money. Okay. So what can you say the total budget? I mean, from all those.
Yeah, I'd have to pull it up we're just in a new fiscal year here, so I got to
Okay.
refresh on my updated. I believe it's around $8 million, split across those funding sources. Again, we got some good. We're grateful to the county for giving us some good support, and we complement that with the federal, state, and grant dollars,
Okay.
as well
So,
as our revenues when we can obviously bill for
oh
some
yeah,
services. So
revenues.
we bring
Right.
in some of that as well, whether it be billing insurance or self-pay out of our clinic. On the environmental health side, permitting, there are some fees associated, like with well and septic permits and things like that.
Okay, so all the inspections that we only pay attention to if there's a problem, but wells and septic tanks and swimming pools and restaurants and you mentioned tattoo parlors.
That's right. We don't have many of them in Chatham County,
I was
but that
gonna,
could change
okay.
over the years. We have had a tattoo convention. So if you see that pop up, it was at the Ag and Conference Center in Pittsburgh. I think it's pretty much annual. So we do permit those.
So there's someone on your staff or on your payroll that checks for sterile conditions and sterile practices.
That's right. Yeah.
Yeah.
So we have multiple folks who are what we call as authorized to basically inspect. And they don't just, we don't have anyone who just does tattoo artists, for example. They would do restaurants or maybe wells, pools. It's a combination. So our environmental health staff, they're wonderful. They're typically authorized in multiple programs.
So are people usually mad at them or scared of them when they come around?
It's a great question. I think when we're all working as we want to be, everybody sees the value in it. We try to work together because for us, we recognize this is something that folks are required to do. Um, but it's really to keep the community safe and healthy. And as a business owner, it's also to protect them and ensure that they are delivering services that are safe for their customers, right? So this isn't something we do just to add another burden to folks. This is really about keeping them safe. And if you've ever experienced a foodborne illness or heard of a foodborne illness outbreak, you'll understand why those services really matter. And so a lot of what we do in addition to just permitting is really about education and working with folks. And so when we work best is when we're having those open conversations when restaurant owners or what have you can ask us the questions that they have. Because at the end of the day, none of us want to shut down a restaurant or deny a permit for anything. That's not what we aim to do. We aim to get to yes, but we are responsible for enforcing state laws, and those are really guided by best practices and often federal guidance. And so that's what our team's tasked with doing, and they do it well, and they do it with good customer service. So I hope that answers your question, and
Yes. Yeah,
hopefully
no,
us
that
showing up isn't the they don't run in fear. It's a work together, but certainly there is a job to do, and it's really rooted in the public's health.
I mean, I think that's the purpose of a lot of government services and government programs is to make life better for the people in our community. And so um, that's one of the reasons we're doing these series is to show all the different ways that government programs in Chatham County benefit people and help keep them safer or healthier or better educated or having more fun and recreation in the community. I mean, we have met a lot of very dedicated public servants who love their jobs and are proud of their jobs because of all the ways that they're able to benefit the community. Okay, that was my
Yeah.
editorial.
Well, I
Um,
really appreciate that. Let me say, I talk to all new staff. I meet with every new staff member we have, and I talk to them about public service. And this is for those who want to work for something bigger than themselves, work for the well-being of the Chatham community. This is a really good place to do it. it may not be for everybody, but for those who are wired towards public service, public health is a great option.
Right. So now for the downside here. Are you seeing effects of budget changes at the federal or state level?
It's something we're always closely monitoring. We've had some impacts. I'd say it could be worse. Certainly, there are other health departments that have been hit even harder, and it could depend on what your funding mechanism looks like. Certainly, shifts in whether it's directly to public health or to other programs can create a strain locally. And so there is some cause for concern, but I can tell you we've actually been able to expand programs over the last year or so. So we continue to try to look at what the needs of our community are at any given time and evolve and adapt to meet those needs. So we have to be creative with it sometimes. We have to best leverage our resources. And like I said, oftentimes often my time is spent racking my brain on where I can pull money from different things to make services available and accessible and affordable. But our team is full of great ideas and a passion for community and passion for public health. And so we keep doing it, and we'll do what we can to weather the storm here. But for now, we're managing.
Excellent. Okay. So just finally, is there anything I've asked you about, or I didn't ask you about, that you'd like the public to know? Services or philosophy or future plans, anything?
Great question. I think we've covered a lot of ground today, and I'm sure I left out some services that'll hit me after our interview, as it always does. Or if staff see this, they'll say, "Why didn't you talk about this?" But we really try to root ourselves in the community, and that depends on relationships. That depends on processes to grow an understanding of what the community wants us to offer, what they need. And that's informed through processes like the community assessment, which we have a very robust process to do that every 3 years. And we even do it in other years as well to go out, including knocking on doors and doing giving surveys and focus groups and things like that, in addition to some other groups and teams that meet to give us information directly from the community about our services, so to inform us and to help us plan and meet the needs of the Chatham community. So public health is a team sport. I've said it before, but I say it again. We need everybody to establish a healthy community in Chatham County. It's an evolving process. There's always going to be work to be done, but we want it to be really guided by what the community's interests and needs are, and so that we're working with the community to fulfill those needs.
So this is yet another jewel in the crown of Chatham County public services. I think a very impressive program and so much broader that I knew, and I read some about this, and I still am learning a lot. Um, so thank you. I think we are finished for this afternoon, and I hope a lot of people are watching this, and those who need any kind of services can get in touch with you.
Please come visit us. Really appreciate your time, Vicki, in coordinating this. Anything we can do to get the word out about what we do, who we are, and what services we offer, we appreciate. And this was a great opportunity. So feel free to reach out to us. Anybody in the Chatham community can stop by, whether they want to get information, pick up resources, or visit us for services. We'd welcome them.
Great. Thanks so much. Have a good afternoon.
All right. Take care.
Bye bye.